Welcome. Today we're going to talk about something that many people living with HIV experience but may not always discuss openly. Physical pain, aches in your muscles, stiffness in your joints, a persistent sense of fatigue. These are not just minor complaints. They can significantly impact your quality of life, your mood, and your ability to go about your daily activities. For a long time, the conversation around HIV has rightly focused on viral suppression and immune health. Before we go any further, it's essential to state something very clearly. The information we are sharing here is for educational and informational purposes only. It is not, and should never be considered, a substitute for professional medical advice, diagnosis, or treatment from a qualified healthcare provider. Your medical situation is unique to you. Think of your relationship with your doctor or healthcare team as a partnership. You bring the invaluable expertise of your own body, what you feel, when you feel it, and how it affects your life. They bring the medical knowledge, diagnostic tools, and treatment options. This article is designed to help you be a more informed partner in that relationship. For decades, we've understood HIV primarily as a virus that attacks the immune system, specifically the CD4 T cells that are so crucial for fighting off infections. And while that is its primary mechanism, the story doesn't end there. We now know that the presence of HIV in the body sets off a chain reaction that can affect nearly every system, including your musculoskeletal system, your muscles, bones, and joints. The virus can directly affect muscle tissue. In some cases, HIV can invade muscle cells, leading to a condition called HIV myopathy. This can cause inflammation within the muscles, leading to weakness, soreness, and fatigue. This can make everyday activities like climbing stairs or carrying groceries feel much more difficult. Furthermore, the body's powerful response to the virus can also be a source of trouble. When your immune system is constantly activated to fight HIV, it releases a flood of chemical messengers called cytokines. This sustained state of high alert can lead to widespread inflammation that affects otherwise healthy tissues, including the delicate lining of your joints, leading to pain and stiffness similar to arthritis. Let's take a deeper dive into a word we've already mentioned a few times: inflammation. It's a term you hear a lot, but what does it really mean in the context of HIV? Normally, inflammation is your body's friend. When you get a cut or an infection, your immune system rushes to the site, creating redness, swelling, and heat. This is acute inflammation, a short-term, targeted response designed to heal and protect you. The problem in HIV is that this process can become chronic, meaning it's constantly active at a low level throughout your body, even when your viral load is undetectable. This persistent low-grade inflammation is a central reason why people living with HIV can experience premature aging and are at a higher risk for conditions typically seen in older populations like heart disease, kidney issues, and, importantly for our discussion, chronic pain. When we talk about HIV-related pain, it's not a single uniform experience. The pain can stem from several different conditions, each with its own characteristics. One of the most direct is HIV myopathy, which we touched on earlier. This is inflammation and weakness in the muscles caused by the virus itself. It typically affects the large muscles of your hips and shoulders, making it hard to stand up from a chair or lift your arms above your head. Another common condition is HIV-associated arthritis. This can present in a few different ways. Some people experience pain in just one or two large joints, like a knee or an ankle. For others, it can feel more like rheumatoid arthritis, with pain, swelling, and morning stiffness in multiple joints, often in the hands and feet. Peripheral neuropathy is another major source of pain for people living with HIV. This is damage to the nerves, most commonly in the hands and feet. Patients often describe the pain as burning, tingling, numbness, or a pins and needles sensation. This type of nerve pain can be particularly distressing and difficult to treat, as it doesn't always respond well to standard painkillers. The symptoms of HIV-related pain can be incredibly varied, which is why they are sometimes overlooked or mistaken for something else. One of the most common complaints is muscle stiffness, especially in the morning or after periods of rest. This is often accompanied by a deep, persistent muscle ache that doesn't seem to be related to any specific activity or injury. It's a generalized soreness that can make you feel tired and run down. Joint pain is another hallmark symptom. This pain often targets the large weight-bearing joints like the knees and shoulders, but it can also affect smaller joints in the hands and feet. The pain might be described as sharp and stabbing when you move, or as a constant dull throb when you are at rest. Receiving a correct diagnosis is the most critical step in managing your pain effectively. because the symptoms can be so varied and can mimic other conditions like fibromyalgia, rheumatoid arthritis, or even just the normal aches of aging. A thorough evaluation by your doctor is essential. When you see your doctor, be prepared to describe your pain in as much detail as possible. This is where a pain diary can be incredibly helpful. After listening to your story, your doctor will perform a physical examination. They will check your muscles for tenderness and weakness, and your joints for swelling, redness, and limited range of motion. Based on these findings, your doctor may order further tests. Blood tests can check for markers of inflammation, such as C-reactive protein, and for an enzyme called creatine kinase, which can be elevated if there is muscle damage. Once a diagnosis is made, it's time to talk about treatment. The best approach to managing HIV-related pain is almost always multifaceted, combining several different strategies. It's rarely about finding one magic bullet pill. The first thing your doctor will consider is your antiretroviral therapy. If it's suspected that a particular medication is contributing to your pain, your doctor may be able to switch you to a different regimen with a better side effect profile. Physical therapy is a cornerstone of managing musculoskeletal pain. A physical therapist can design a personalized program of exercises to improve your strength, flexibility, and range of motion. Gentle, regular exercise is one of the best things you can do to combat pain and stiffness. Activities like swimming, walking, cycling, and yoga can reduce inflammation, boost your mood by releasing endorphins, and help you maintain a healthy weight. Finally, never underestimate the power of complementary and mind-body techniques. An anti-inflammatory diet, rich in fruits, vegetables, lean proteins, and healthy fats, can help reduce the chronic inflammation that drives pain. Techniques that manage stress, such as mindfulness meditation, deep breathing exercises, or Tai Chi, can also be incredibly powerful. Stress is known to worsen pain perception, so learning to calm your nervous system can have a direct and positive impact on how you feel physically. Most importantly, please hold on to hope. The landscape of HIV care has transformed dramatically, and the focus on quality of life, including pain management, is greater than ever. You are not defined by your diagnosis or your pain. There are effective strategies, dedicated healthcare professionals, and a strong community to support you. We've come so far, and the future of HIV care is about helping you live a full, active, and joyful life. Take it one day at a time, celebrate small victories, and remember to be kind to yourself through this process. You have the strength to manage this, and you don't have to do it